All right, welcome back to the Bolus Maximus podcast. My name is Matthew Taro. I've got my co-host and co-founder here today, Brandon A. Denson. Mr. Denson, good afternoon, good evening.
Good evening, good afternoon, good morning. Oh, did I say that backwards?
You can say whatever, any way you want. Excited. Brandon's got a guest that he brought to us today. Very excited to speak with Steve. Steve, welcome to the program. Thanks for joining us.
Thank you for having me.
It's a pleasure, and we're excited to talk to you a little bit today. We've got some conversation about misdiagnosis and late diagnosis, substance, and just being an overall survivor throughout your journey. So I do appreciate you sharing some personal stuff with us today, Steve. So I'd love to ask you if you could tell me about your diagnosis. Seems like this is something super recent. We are recording here in June of 2022. But you were just recently diagnosed as a type 1 Lada?
That's correct. Yeah. In March, I was diagnosed type 1. I had been, do you want me to go right into the whole diagnosis story now?
Dive in it. Yeah.
I was diagnosed type 2 probably 12 or 14 years ago, maybe. And, it started with being pre-diabetic and watching my A1C kind of slowly go up over the years. And, I've been through some stuff before to where I just wasn't in a position where I wanted to deal with it. So I wasn't really what I would say a very good type 2 diabetic. I didn't test a lot. I didn't put a lot of effort into trying to control it, just to be frank. And, after some time, I decided that I needed a new doctor because the one I had, he and I just weren't jiving. I wasn't motivated by him, I guess. So my father-in-law had a local doctor that he just raved about all the time, and he got me in to this new doctor, and right away, which is when I say right away, I guess it'd be about a year ago, he started running some tests, and I had the marker for Lada, which is the GADA or GADA antibody. He ran right away. He ran a C-peptide test and found out what my level was there. And we kind of went on over the course of the next year. They tried a type 2 diabetic drug, and I can't remember the name of it. There's another one on TV that's got a catchy song all the time.
Victoza, Farxiga.
It's something in that category. So, I'd been on metformin and glipizide for years, and finally it was time to try something else. And I tried that medication. It made me feel awful, so I stopped taking it. And I just went in for a routine doctor's appointment in March. They ran my A1C. It was crazy high. It was 13.2, I think.
Oh man.
You probably felt terrible.
Well, that's the thing.
Just physically, you probably felt terrible. Not the number, obviously, but you're feeling.
I really didn't have any symptoms like that. He sent me home. After he said you need to go to the lab, and they did a blood draw there, and they sent me home, and he called me that night, about 8:00 at night at home. My doctor did, and said your blood sugar is 591. Said I want you to. Oh, he sent me home with Lantus too. We agreed to start that to see if we could control what was going on with that. So he said start the Lantus. Don't eat any starchy carbs, things like that. Be real careful what you do the next few days. If you feel any different, go to the ER. So I now know that I probably should have tested for ketones at that point, but I took the Lantus, and the next day started testing my blood sugar that night and the next day, and it did come down. It came down probably to about 240, and really that's as low as it would go on the Lantus. So at that point, I went to
Wow.
I was referred to an endocrinologist. I went and saw them and got the fast acting insulin and started that program. So they also scheduled me for an eye appointment, which they told me I might have some background retinopathy and things like that, which really, really scared me pretty bad. So
Yeah.
wow. I just decided right then and there that day I gotta, do everything I can to learn everything about this and start taking care of myself. So that's how it got to that point. The misdiagnosis part, I would guess the one symptom I had over the years was if I got lazy about refilling my metformin or missed it for several days, my vision would get blurry, and it would stay that way. My long distance vision would be blurry for probably 3, 4, 5 days before it came back to normal once I got back on the metformin. And I didn't realize it at the time, but when your sugar gets to a certain point and stays there, sugar moves into some part of your eyes. I don't know. The doctor explained it to me, but it actually causes the shape of the lens to change, and that's what causes your vision to get blurry. So I remember the very first time that happened specifically because I happened to be driving in Canada for work, and it was really weird. And that was about 4 years ago. So I would say my sugar has been significantly elevated probably for 4 years, with the metformin doing some of the work to keep it down, but obviously
Not enough.
within the last 4 or 5 months, my C-peptide really started to drop off. When he remeasured it had come down more than a point since the last year. So,
Oh wow. And that makes a big difference.
right. So
If anybody listening is unaware, the C-peptide test is conducted to find out exactly what amount of insulin and at what rate, or what amount of insulin, I'll tell you what rate, but how much insulin the body is actually still making. So for instance, for a state insurance program to get an insulin pump through Tandem when I worked there, for a type 2 diabetic, you had to have a C-peptide of a certain range to qualify to be able to get a medical device.
And can you hit that for us? Can you hit that button for us, please, Matt?
Oh man,
Please
I
and
don't
thank
know
you.
which one.
Oh, well, if you don't know, it's fine. We just like to let you know we are not trained medical professionals.
None of us are.
Disclaimer, disclaimer, discllaimer.
Yeah, we forget.
No, but
We shouldn't forget it, but we forget it all the time.
as you bring that up, Steve, that is we hear that a lot with Lada and people being late diagnosed, that they're taking a type 2 drug, which isn't going to do anything if you have type 1, which clearly, like you said, it brought it down, but it still was at a very elevated level with you taking metformin, on a consistent basis. And I don't know, it's becoming more and more common that people are being misdiagnosed, which as a patient, that's kind of scary, because it's like I'm putting my life in your hands and I'm expecting you to put me on the right path to help me get better, or get the right type of treatment. But it's also it's actually reverse of what's going on. They're giving you something that actually won't work for you, because technically you were type 1 from the very beginning and it was overlooked, so um it it
right.
it it, it, it it sucks. But I'm glad you're on the right path now. I'm glad that you're hopefully you're feeling better. Hopefully with the medication that they have you taking now, that is actually working and it has you within the ranges that you would like to be in, that your doctors would like you to be in, endocrinologists or primary care physicians as well. But yeah, man, it freaking sucks when I hear it, because it's like we know people that have been through this, and it's like, I couldn't imagine going a year with not the right medication, let alone 3, 4, 5 years. You know what I mean? Like, it's just like, and then I also think about the consequences and the damage that puts stress that puts on your body too. You know what I mean? And I think
And
that's something.
and your emotional and mental state? Because, Steve, if you don't mind me asking, did you lose trust in the medical field and profession or doctors throughout this process? Or did you feel like this is something that you were kind of working with them on? Or did you get to a point where you were just like frustrated and more angry at like, why aren't you just telling me, why aren't I feeling better?
Yeah, I mean, I have to bear some of the burden here. Like I said, I didn't test like I was supposed to. I didn't take it as seriously as I should. So I didn't have
You were
as much.
operating under false pretenses though, right? Like you weren't, it wasn't,
Yeah, but I really wasn't giving good information back to the doctor that I changed from either. So um
appreciate you saying that.
part of it's on me. Part of it, he probably definitely should have done the antibody test, and that'd be my message to anybody out there that's working hard with type 2 diabetes to get under control and not seeing results. Is just have them run that test, that panel, and you'll know if you have the antibodies that would put you in the Lada or type 1 category. And there's no reason um, to battle against it without knowing if you're not having the results that you think you should be having from diet and exercise. So
For sure. I think that makes a lot of sense. I mean, I think, because a lot of people do with type 2, they say that that they do struggle. So it kind of, I'm glad that we're bringing awareness to this, because that could be a situation. And Matt has worked in the industry, and he's dealt with type 2 patients along with type 1 patients. So hearing that they may be slightly on that verge of maybe really being a type 1 versus a type 2, because it can change. Things can change. I mean, obviously type 1's just somehow out the blue we become type 1, and then there it is. You know what I mean? So I think you could be on that verge of being type 1 when you're already a type 2 as well, at any point in time. But no matter what, the diet, the exercise, the lifestyle, the reality of it is, like you said, the C-peptide test, that's going to kind of be the determining factor on kind of how, like, really what's going on. So
and the other thing is, I don't know that I know I didn't, speaking for me personally, really understand the long-term consequences that can come from type 2. I think it's not taken as seriously. Type 1, obviously, it's, you're in
Yeah.
a life or death situation if you don't do the right things. But I don't know that type 2s get enough education about the long-term damage that can cause, which, is just as prevalent or more prevalent than happens, with type 1s that aren't well controlled over long period of time. So
How much more involved do you feel like you are in your care now versus a year ago? Like what?
100% more. Yeah.
Okay. And then how much more involved do you feel like like generalization kind of 30,000 foot view compared to what you thought you were dealing with versus what you are actually dealing with? How big of a difference is there? Does that make sense?
It's a huge difference. I just really wasn't dealing with it properly before. As soon as I found this out, and especially when I heard about the news from the eye specialist, that
Yeah.
I just immediately dove into countless hours of listening to podcasts like yours and others, YouTube videos, just everything I could consume to try to educate myself on what do I need to do here? What's the best way to handle this? What's the best diet for me? Just it's like somebody said, drinking from a fire hose, and that's what I did. But I put the effort in finally that I wasn't putting in before. So
first,
it's a big difference.
first and foremost, I want to say thank you for listening to our podcast. And we're glad that, whatever you were able to get out of it from a plethora of guests that we've had on, just dropping knowledge and gems. And it may just be one little thing. This is why we do what we do, because we know that everybody's diagnosis comes at a different time. Everybody gets diagnosed and they're on a different path. They come from a different background. They come from a different demographic. All of these things are very different. But one thing that is the same is we have to deal with the same things every single day as everybody else. When we wake up, during the day, when we go work out, when we go to sleep, when we eat, all of these things are the same. Now, the way we take care of them are going to be different depending on where you're from, demographic, background, culturally, all of these things. But we have to take insulin. We have to check our blood sugars. Some of us wear insulin pumps. Some of us do multiple daily injections. But at the end of the day, we all have to do literally the same thing. And you said something, and it really stood out to me. You said the only people like with chronic illnesses and recovery that really understand this are people that actually have to go through it. And when I saw that, I was like, man, I was like, Steve gets it. He gets it. You know what I mean? And you really do, because when we're looking at it from the outside looking in, somebody will look at us and be like, oh, you look fine. You have diabetes. And it's like, it can look very different for everybody. People think that you have to be overweight. Some people think that just because you look in shape, that means that you don't have it, and so
Or
on and
you
so
or you're
forth.
young, right? Or
Yeah,
you're a certain age.
yeah, or or you're young or a certain age. But the reality of it is, if a person tells me that they have type 1 or type 2 or later or type 3C, like for me, I know what they go through soon as they say it. Somebody says they're type 2, I know that because I've been around a lot of type 2 individuals that have type 2, and I know people personally, family, friends. So I understand what they go through. But your typical person that doesn't know anything about diabetes, they don't really understand what we go through on a day-to-day basis. They don't understand it. And that's the
So
toughest part. That's
let's talk about some of that stuff, right? So they understand. You're obviously, Steve, you've gone through some stuff that I feel like others are lucky not to have to experience. I can speak from experience myself personally with my own family. But you are a survivor. You are somebody who has gone through multiple rounds of cancer treatment. Is that okay to say? It's been a couple of years since there's been any sign of that in your life. Is that correct?
Yeah, it's that was in 2001. Actually, I was quite a bit younger. I was 31 then. So they found a mass in my abdomen that required a big surgery. And looking back on that, that was a very scary time. And then all the stress and anxiety leading to the follow-up scans. You know, you have one at 3 months, 6 months, a year, year and a half, 2 years, 3 years, 5 years. Then finally they tell you this, you're good.
Yeah.
So I know during that time I wasted a lot of time with high anxiety and fear over something that never returned. Kind of wish I could go back and deal with that differently, but it was very stressful. So when I get this diagnosis, I was in a better position to handle it. Just to, grab the bull by the horns and get going, because sitting there worrying every day doesn't change anything. So that, I guess that, and I am okay now. So that helped me prepare for that.
I don't, and I mean this respectfully. I don't know how being substance free and not having something to lean on sometimes to deal with. There's therapy, there's friends, but a lot of people in their life they rest and lean on something that comes from a place where there aren't many rules, and sometimes you kind of get out of control, and life has a way. I think Jeff Goldblum said once. Um, and so I'm interested to know what. Sorry, that was my dog. I'm interested to know about how you had to build this bridge for yourself mentally, emotionally for these years, and then you get to this place where you're like you should be through the jungle, and all of a sudden it's like, oh yeah, hey, by the way, type 1 diabetes. How do you
Yeah.
how do you deal with that, if you don't mind me asking? What what is your secret? How do you do what you do, Steve?
I mean, it's not a secret. I'm old. So I'm 51 now.
You're
So,
not, man. You're not old,
You
man.
look great
That's
for
not
51,
old.
man.
What are you talking about?
For those listening, Steve looks great for 51. I would have said, 37, 38. Take that hat off. How much hair you got?
There's no substitute for time, right? So you go through life, you go through good things, bad things, and you come out the other side. So my sister's been type 1 diabetic since she was 17, so 25 plus years. So it wasn't totally foreign to me. Her son and my nephew Jack, shout out to Jack, he just came up fishing a walleye tournament with me this past weekend, so we had some good bonding time there. Is also type 1 diabetic. So I had some resources right away to ask questions, help me through some things, get me started on the right path.
Is that an Omnipod?
Yeah, that's my new Omnipod. I got it Monday.
Hey,
Congratulations. How do you
hey, we're twins.
how do you
Hey.
how do you like it, man? That's awesome.
It helps a lot. When I did Lantis, I have different, as I'm sure almost everybody does, different basal requirements. So I require more in the morning, less in the afternoon, and then kind of steady the rest of the time. So it was really difficult to control that. I had to do a lot of correction and injections with my my Novolog, and this has helped kind of flatten that curve, so to speak, by being able to have those different basal rates at different times of the day. So it's been pretty cool.
Right.
That's
on.
awesome. That's awesome.
My excitement can't be put into words. I can't even I don't even know if I'm able to share it, but like that is one of the most exciting things. And I was thrilled to work at a company like Tandem with the true real raw facts is most people don't get to use these products. They don't know what it's like to have an ease of slapping something, throwing some insulin in a pod. I don't mean to make it sound so easy, but it's easier than some of the other processes that people that live with diabetes are going through. I thought the pod was great. I currently use a Tandem pump still, but it's amazing to see where we've come from, to see where we're headed. And that's something I think that barrier gets broken when you hear something like about your eyes, and then it becomes, well, how do I make my diabetes easier for myself? And implementation and this process, it's like, well, could I just wear a little I can wear a little pod? Perfect. I don't know. I kind of like the pods. I'm thinking maybe I'd go back for a couple of rounds of pods without tubes because I've been connected to this stupid thing with a wire. But I think that personal preference and that freedom is it's so needed, where people aren't getting even that choice to make, or to understand that they have a choice to make, to pick one of those products. And I'm super excited for you. So congratulations, man. That's fantastic.
Can I ask you this on the pod? Did you just feel that was the best one for you, or was that more so like your endocrinology team or medical staff team?
They actually recommended the Tandem, but I work in a lot of mechanical spaces. I fish with kids a lot, so that tube was a little. It didn't fit my my lifestyle. But
that makes sense. It can be a pain in the rear sometimes. I wake up now and I'm like, oh, I don't have my insulin pump. I was like, oh, it's on my stomach. Oh, okay.
I did like the control aspect, the control IQ, or I'm not sure which one that is, but so this is the Dash, not the Omnipod 5, but
okay.
Eventually I'll probably be upgraded to that. But I mean, going back to what you asked me earlier, I also got diabetes at a pretty good time compared to my sister, or even you guys. The technology has come so far in the last few years, just from what I know, being new to it. But but looking back and listening to podcasts and hearing people talk about it and knowing what my sister had to do back in the 90s, it's totally different now. And I think that's another reason that it's definitely easier for me than it was for that generation.
The changes over the years have been pretty drastic, to the point where lifestyles are so different, where it's not impossible for people to communicate, um, what they went through, but there will be a significant gap in the next, I don't know, 10, 20 years, where the kids that are being diagnosed with diabetes, because if you're listening to this, you got to be real, it's going to continue to happen. And the more kids that are diagnosed and the more that this happens, it's like, there's going to be a gap between the people that are specifically only use syringes, that had to test their blood sugar with urine. Like, we've spoken to some individuals like that. My mouth is just like, you did what? I was like, wait, what?
It's always cool. It's always cool to hear individuals that are older that get diagnosed, that are willing to try the technology. And I think that that's huge too, right? Because or even if you were in that stage to where you were diagnosed, um, kind of prior to like a lot of the technology, you only know one way, and that's taking shots. Because a lot of people, they don't want to make that adjustment. Just like anything, when you begin to start doing something new, it's going to feel uncomfortable, it's not going to feel normal, it's not going to feel pleasant, it's not going to feel good. But as you begin to learn it, and you realize like, oh, this does make things a little bit easier, and it does make my daily lifestyle a little bit easier. So like when I hear that I heard it beep, I was like, is that mine? I was like, no,
Yeah.
I was just over here messing with it, put my blood sugar, and I was like, I don't think it is. And that's why but it's cool because I think the more and more we can talk about the technology and bring awareness around it, but then also let people know that it is there and it is a tool that they can use. At least they know that it's available for them. And I think, like I said, the more and more we talk about it, the more people will realize that, oh, it's an insulin pump. Oh, there's a CGM, and I'm not going to say it makes everything better, but at the end of the day, it does make things a little bit better.
And it's kind of funny because I actually thought, as I heard the beeps, I was like, "Oh, I love that that's in the background. Like, it's so organic." If you're listening to this and you haven't heard individuals interact like the three of us just did, that is what an organic type of conversation that might happen in the wild. That's how it goes down. I have been in the grocery store and heard beeps, and like, you hear my popping out around the corner, like, who's beeping? I know what that is. And it's like, sometimes I saw a woman yesterday, she had a Freestyle Libre on. I don't know if you've seen the real thin, small discs. I saw it on the back of her arm. I didn't say anything. I kept walking. It wasn't appropriate, right? But sometimes, like, I make eye contact with somebody and I'm like, oh, you check it out. And then we just start talking. Have you met a lot of people that are in your similar situation, Steve, who have gone through some misdiagnosis like you did, and kind of went through that? Or do you feel like you're siding and learning more about people who've kind of type 1 or Lada and have been dealing with that for a while?
Well, I listen to everything I can because everybody is, I mean, Lada is basically type 1 diabetes. So whatever information I can get that I think might help me. I think it's interesting to hear everybody's story and how they deal with it, and what they're doing now. I don't know anybody personally outside of my sister and my nephew who live in a different state with type 1 diabetes. So I do some things on Instagram, but I mean, when you go on Instagram and create a name and T1D Steve is available in 2022, that kind of shows you that, there's not a guy around every corner that's got type 1 diabetes.
Yeah.
It's a good gauge of your environment.
The social media. Yeah. No, No, Steve, this has been awesome. But we can't let you escape. Well, I definitely can't let you escape without asking something in the sports world. So obviously you are a home of the Boilermakers. So I want to ask you this. Coming from Michigan State University, I'm from Michigan. We're both from Michigan. Yeah, Matt, you got it. You got it. Who's gonna win the Big Ten in football this year? I'm curious. I gotta. Who do you are you betting on the Boilermakers, or are you or
I would never ever bet on the Boilermakers to win the Big Ten, but I don't think it's going to be Michigan State this year either.
Oh, ouch, that hurts. Oh,
I,
Not me, but it's
so you
not.
gotta give us somebody then.
God, I hate to say Ohio State
Ooh,
or Penn State, but I think they're going to be pretty good this year.
okay.
No, I think the Spartans are coming though. My son's best friend, I think I told you, is got a full ride scholarship to play in the O line there.
Yeah.
And he redshirted last year. He's going to play this year. I don't know that he'll start or not, but so it's fun to watch. I'm not a Spartan hater. I got my Spartan
Oh, look
cup
at
here.
that.
Go green, baby. Go green. So
So,
so then hopefully he doesn't hear this podcast, because I know he doesn't want to hear you say Ohio State of all teams. But I guess that's better than saying Michigan. So that's cool.
I think that program's up. Michigan State's up and coming though.
Yeah, yeah.
In fact, I heard your coach say he thought they could compete for a national championship in 3 to 4 years. So
I mean, Tuck had an opportunity to meet him last year. Very outstanding guy, coaching staff, very outstanding. I've been removed. Me and my buddy went up there, and it felt like we were back at home. We were welcomed with open arms, and it felt good. I think culturally, he's changing some things up there, and I think when you have a new coach, he took a lot of stuff the first year, and it's like, look, these aren't his guys. Once you get a coach in there and they start to get their guys, get their recruits in there, get their systems flowing, and the expectation is clear, and you start to see things change. And you're saying that, is this year 3 for him? Year 3, 4? So you see the change. You see the change.
that's what they say about the Detroit Lions every 3 years, when they bring the new coach in.
Yeah. Listen, we got burn victims over here in Michigan. Before we one more thing. He said one more question, but this is it, because I think this is super relevant. You guys put your little hands up and point at the web of your thing. You're like, I live here. I don't know much about that part. Like, I'm from the East Coast. I moved to the West Coast. I live in Denver now. I think environment plays such a massive part of how you deal with your diabetes. And I'm interested to know a little bit about your region or area, like where you're from, and how is diabetes looked at in your surrounding area? Is it not talked about? Is it something where it's on the rise? You can tell that there are a lot of people that are dealing with it. I'm just curious about your experience, if you could speak on what you see around you.
I think it's growing everywhere. Maybe Brandon can comment more, but I know Detroit has a pretty high prevalence, especially in the type 2 market. I think I don't know. I worry about environmental factors. I start to question whether COVID has maybe triggered some type 1, but I don't know about that. Outside of that, environmentally, I don't know that there's a big difference between Michigan and anywhere else, but it was really an eye-opener to me once I started studying this and listening to podcasts, watching YouTube and stuff, that the discrepancies that people have and the ability to get supplies, especially like insulin and some of the technology. As a non-type 1, I had no idea that there was those kind of struggles going on. So I think the awareness factor needs to be raised outside of the community to get some some support from, you know, whether it's legislative or what, to empower those people that can't get the things they need, because you know, it's a growing problem everywhere. I mean,
Yeah, I'll piggyback off of that. I obviously I haven't lived in Michigan for close to 5 years now, but when I was there, I did see a huge amount of type 2 diabetes. But then I also saw the fields that I was in, especially when I worked in the city of Detroit. uh I did see type 1 diabetics and mainly teenagers and youth. But I did see, like you said, that lack of awareness, and maybe not necessarily. I can't put it on the kids, because, like, even though they live with it, like, there has to be an understanding from the parents as well, because they're the ones that are actually the caregivers for those kids. So there was a lot more type 2 that I saw, but I definitely saw there was a lack of awareness on, like, technology, awareness of just the disease in general, and then also those individuals that had type 1 or type 2 having specific outlets to where they felt comfortable discussing it and going to people and having, I don't want to say necessarily support groups, but people that they could speak with and understand them. I think that was something that really lacked a lot.
Yeah, the focus for us at Bolus Maximus, and I appreciate you sharing that, Brandon and Steve, about your background and some of your experience. Our goal is to make sure that individuals know who is lacking resources, what the resources are, and how we can get them to them. We're starting that process by identifying individuals in certain communities, reaching out, doing what we can to spark these conversations, and talking about some tough stuff. So, I think you brought a lot of really great experiences to the table today for us to discuss, and I'm very thankful, and that creates a lot of value for people that listen to us. I mean, we're just a bunch of guys talking about diabetes. We're not medical professionals. We're not, just nothing. We're just a couple of guys, a couple of young, good-looking guys that are talking about diabetes in a way that I think needs to be more open, inclusive, understanding, accepting, right? So we can't just be, well, tell me what's going on. All right, you're all right? Are you okay? Okay, get out of here. And one of those major resources is going to be for men. It's something that Brandon and I have realized. We didn't have certain resources in the last 5 to 10 years, and by golly, really needed them. So if they don't exist, we can't create everything all the time, but we can raise enough conversation and spark enough interest in something that we believe other people would benefit from. So, but it's a long conversation, and we're just getting started. So we appreciate you being here and sharing that. It sounds like, in the future, if you've communicated with your sister and she's listened to this, hello sister, and she feels like joining us and talking about the family experience, and that's always very interesting to individuals as well, is how to communicate with family members. It's not easy, and there's 3 different generations there speaking about diabetes in your family, so I think that's something very valuable as well. It looks like we just booked a second date for you. But again, it's so valuable and exciting to speak with somebody like yourself, and we're very appreciative. Is there anything you'd like to leave us with? Anything you'd like to share before we let you go and enjoy the rest of your evening?
Yeah, I'd say if you make that connection with somebody that can help you, or that it's a support for you, I think it's important to talk to those people on good days too. I think a lot of people miss that, because if you talk to somebody on a regular basis when things are good, it's a lot easier to pick up the phone and talk to them when things are bad. I think that's important for people that are looking for support to develop that relationship, so that it's easy to reach out when you actually do need help. Because it's easy to say, like you said, how you doing? I'm good. Okay.
Great talk.
Yeah.
I had a deep conversation with Steve today.
Right.
Someone's like, did you guys connect? Yeah, deeply.
But if you talk to somebody regularly and you just talk about news, weather, and sports for 10 days in a row, and then you have that one day where it's, you need that person, you're more likely to reach out and get the help you need. So I think that'd be my suggestion there. And then it's been said over and over on here, I know, but educate yourself so that you can advocate for yourself.
Yep.
And get the things you need.
You are your biggest advocate. That's something we stand by.
Yep.
You are your biggest advocate, and you ultimately, you may not necessarily know everything, but you know what will work for you and what could possibly be best for you. Yep.
So Steve, what you gave us today is going to help other individuals, everybody listening, from both Brandon and myself and Anna, the Bolus Maximus people joining the calls and the team and what we're building. We appreciate you and your stories and experience. So thank you for your time. And we look forward to speaking again, because I think some of these topics obviously have sparked some follow-up for us. So the more we can learn about you, the more we can help other people, and just keep this momentum going. So hope you have a great rest of your evening and week and rest of the month, and moving forward into the summer. I can't imagine. It probably gets pretty hot out there. Jump in one of those big ponds you guys got. I think, what are they? Finger Lake,
Michigan, man.
Oh, what is it? Oh, it's Lake Michigan. Okay. But we'll have to get you back and talk again. So for myself and Brandon, we appreciate you. Keep it 100, everybody. Thank you so much for joining.
We appreciate you, Steve. And as always, keep it 100.
I took your line, bro, before you could say it.
Thanks for having me, guys. I appreciate it. I hope get some things that will maybe help people out. I'm not an expert at diabetes, but
none of us are, man.
Been through some things, and I know that finding your support group's important. So
we can hear it in your voice. I think it's important for me to explain that, like, the value that individual, it's a raw conversation. It's very organic, right? We didn't set any of this up. It's just, this is how it is. And I think the more that people understand that, they can see that, they can hear it, they can feel it, right? Emotion.
Most importantly,
emotion is left out of diabetes conversation, discussion, education all the time. And the mental health element is a major part of it. So we are by no means saying anybody is perfect, but it seems like you've definitely done a hell of a job for yourself given the circumstances. So yeah, we're big fans of Steve. So all I can say, my friend.
That's real.
Big fans of Steve. So thank you.